Now we're going to invite Suzanne up. Suzanne is a success story of how to look fabulous and feel fabulous when you get to a certain age. Come up, Suzanne. Take your time, darling. It's lovely that you could come today. It's fantastic.
Thank you for inviting me.
There's your microphone.
And what a day, a beautiful day.
Yes. So Suzanne is actually one of Victoria Taylor's patients as well. Victoria Taylor's a naturopath. And Suzanne is so amazing for a woman who's in her 70s. Can you believe that? She told me I could tell you. But I mean,
when you know. At that age, you don't mind who knows, really. You get past worry.
Well, yeah. Now you have to hold the microphone a bit closer, darling. Yeah. So it's just amazing that you can feel like this in your 70s. You used to think that once somebody got to 60, they were geriatric. Well, actually, the definition. The definition of geriatric is 65.
It is.
I told my sister that, and she's 63. She said, "Oh, rubbish," she said. "It is not." I said, "Yeah, I'm sorry."
Change the bar,
But you're changing the bar. We're going to make it 80. Yeah. But I remember, studying medicine that, the geriatricians only saw patients 65 plus. So fantastic. Now, Suzanne takes bioidentical hormone replacement therapy. So this is something that is very popular in the United States of America, but also a lot of women in Australia are turning towards it more and more. So how long have you been on it, Suzanne?
15 years. 15 years.
Yeah.
And it's been wonderful because it's a gentle, it's not anything drastic. It's just something that boosts that, takes away the anxiety, and, it gives you serenity, really. Yeah. I went through a change of life, and, my blood pressure went up. I became anxious. I was really a ruin, and I'm not that sort of a person, I'm usually very happy and calm. Happy and calm. I'm not used to this, obviously.
I can tell, yeah.
Happy and calm. So I went to a professor, Sandra knows.
Oh,
the
yes.
professor I went to, and he recommended the Troche for me. And
that's a lozenge, a Troche.
That goes in your cheek, and that releases the hormone. But the beauty of it is you only take what you need. You don't have to take, it's not like a package, is it? Package.
Yes. It can be tailor-made because, everybody's different. Some women go through an early menopause, some women go through a late menopause, some women sail through menopause, they don't even notice it's happened. Other women fall apart. They're like this extinct volcano that suddenly erupts. Yeah? Was that you?
Crying all the time. Just sad, and I'm not a sad person.
No.
So, and then I just felt normal. I didn't feel different. I felt my old Suzanne again.
Did you? How long did it take to work?
I'd say a few months.
That long?
I'd say a couple of months.
Okay.
For everything to level out.
Yeah.
But I'm on Sandra's Magnesium Complete, and I don't have to take blood pressure medication anymore.
Yeah, magnesium.
It's regulated because the hormones settle to a certain extent, don't they, by themselves? But you need
nutritional medicine as well.
And people just don't understand. I think it's ignorance, really, that they think, I don't know what they think.
Yes.
They say, hormone replacement. And I said, well, why not? And I've got an aunt who is 100 on the 30th of May, and she's been on it for...
She's still on it?
How many? Yes.
Isn't that amazing, at 100? Does she look
She's on an antidepressant as well.
Oh, yeah.
My cousin's a pharmacist, so he said, look, we'll give her an antidepressant. We won't tell her what it is.
Oh, good idea.
And so she's all nice and even.
And so she looks good too for 100?
She looks marvellous, yes.
And what's her memory like?
Good.
Oh.
Yeah, she's got 6 children and many, many grandchildren and great-grandchildren. She knows them all their names.
Oh, fabulous.
And here we are all forgetting.
Oh,
So maybe it gets better as we get older.
Yeah, so since menopause, you've got better, you think, since you've got the right treatment.
Definitely. Most definitely. Yes.
And so do you intend to stay on the hormones for a long time?
Yes, I do.
Yeah.
I do.
Because they really helped your mental state.
Yes.
And do you think they've played a role in anti-ageing for you?
Yes, I do. I would say definitely yes.
So you take the lozenges and not the creams?
Well, the creams now.
Oh, you're on the creams now. So you can take either lozenges or creams.
And the cream's very good. You just rub it into your bottom or your tummy.
Yes, rub it into your skin.
You prescribed that one for me,
Yeah.
Sandra. Yeah.
And you take the estrogen, progesterone and testosterone. So you're taking all 3 sex hormones. That's good. Yeah.
That might be why I feel so good. I've got a lovely husband.
Oh, have you? Oh, well, that helps.
It does, doesn't it? Yeah.
Well, you know, hormones do affect our state of mind. There's a lot of receptors in the brain for hormones. For example, women who get really bad postnatal depression, you know, within 24 hours they have a major shift in their mental state, within 24 hours of childbirth. And that's because when the placenta is delivered, after the baby, there's a catastrophic drop in the level of sex hormones in the body. And historically, women would eat their placentas because it's full of progesterone and some estrogen and testosterone, you know, all the sex hormones. And that was called placentophagy, women eating their own placentas. And it did prevent that catastrophic loss of sex hormones after childbirth. But now people don't do that. And so what happens, they give antidepressant drugs, which can help, definitely, with postnatal depression. They can be life-saving. But you also need the natural hormones. So we can use natural progesterone and natural testosterone, and that can make a huge difference to depression in women, a huge difference. And we can also use the magnesium, as you said. It relaxed you heaps.
Yes.
And B vitamins and
you
sleep well.
Yes,
Yeah.
it makes a big difference.
Yeah, the hormones help you sleep.
Yes.
You've got to sleep.
Yes.
I see so many people who can't sleep. Hands up those who can't sleep. Yeah, it's terrible. Well, magnesium is wonderful for sleep, and sometimes you need quite a big dose. Yeah. So, all right. Well, look, thanks for that, Suzanne.
Thank you.
You've been a real sport letting us know how old you are, because nobody believes it. Nobody believes it.
Now, I didn't get an invitation to come up here, but I'm going to let all you lovely people know that Suzanne's doctor wants a copy of her script. And I'm wondering if that's for his wife.
Yeah. More and more doctors should know about bioidentical hormones. You know, the most commonly prescribed HRT is Premarin, and that comes from horses' urine. That's horses' hormones. And I'm not really in favour of it because, you know, one of the side effects is you start eating chaff for breakfast and you gallop round the backyard. So we don't want that. And also it involves a lot of cruelty to horses. So we can easily turn to the bioidentical hormones. They've been proven in research to be much safer than the conventional oral hormone replacement therapy. Much safer.